Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the Corset Body Lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape. Hey, Dr. Moya.
Hi, Brittany.
Funny to see you here today.
I love it.
How are you?
No, I'm great. Thank you. How are you?
Oh, wonderful. Wonderful.
I can see that.
Yeah. So let's talk about the surgery centers, options, places to have surgery, a patient coming to you, having a consult. There's a couple of options. And some of them are actually surprised to know that we have our own ambulatory surgery center. A good amount of people assume that you just go to the hospital, which is the other option, Evangelical Community Hospital. Tell me the differences between the two or what you would do where.
Another great question as usual. We do offer those two options. The reason why we offer the hospital option is there are some patients that really need to be done in the hospital. That'll be number one. Mm-hmm. Okay.
Health-wise.
And that usually goes by age, I would say. Somebody in their 60s or even in their 70s, they still deserve to have a great body too.
Of course.
They lost all the weight. Mm-hmm. So we want to help them, but it might be safer to be in the hospital. Mm-hmm. So that's number one reason. Number two can be that I might be able to save them some money by getting a lower apron skin removal covered by insurance. Mm-hmm. We don't do those in our surgical center. That has to be done in the hospital. That's where the cost reduction occurs. It's the way we have it set up with our community hospital. And so we push for that. If we feel that patient is a good candidate for that, help them save money, then we're going to go to the hospital.
Clarification, you do the removal of the lower apron here at the ambulatory surgery center, but if it's only done at the hospital if they have insurance coverage for it.
Correct. And remember, we don't do a lower apron removal alone anyway.
Right.
It's always bundled into a body contouring procedure.
Right.
The difference is if we can get it covered by their insurance plan, then we go to the hospital as long as the hospital participates with their insurance plan. And I know that we have a great podcast on that we've already done about insurance.
Right.
But yes, that's the reason why we go to the hospital is to save money. If we can bundle in a paniculectomy, abdominal apron removal with a body contouring procedure, and it's covered by their insurance plan.
So it's a split claim or split bill, as we call it. So part of it's insurance and part of it's cosmetic.
Correct. And we have it set up again where it saves money versus going to having surgery done in our own ambulatory surgery center, which saves money also because it is a private center, which we'll talk about and how we can save money.
So are the procedures that you do at the hospital just the lower apron, lower abdominal fold, basically?
That is correct. That is all that I offer when it comes to skin removal that could partially be covered by insurance. And I work, and that's part of it is because that's all I have worked out with the hospital. Otherwise, anything else, arms or thighs, there are some codes out there that might be covered, but we don't have the setup at the hospital to save money.
Right.
So we don't offer it.
Right. And basically it would just be one of those body contouring procedures, a corset body lift, fleur-de-lis, no long cases, like nothing longer than that.
Correct. So I used to combine body areas at the hospital because you're in the hospital. So you have to stay, you would stay overnight if we decided to do that. We had that option. And so I used to combine procedures such as a corset with arms or a fleur-de-lis with arms or thighs. But today we limit surgery like we would in our own ambulatory surgery center to about 8 or 9 hours.
Okay.
So it kind of limits, has started to limit it, which I think is okay because it's at the end of the day, if you're doing it all the time, that's a lot of surgery for the surgeon. The patient's asleep. The other staff kind of rotates in and out.
Yeah.
But I'm still me.
Yes, you're still trucking along.
And I'm not that old. I'm 54, but I'm not 20. I'm not 34 or 44.
Right.
So makes a little bit of a difference.
A little bit at the end of the day. So on a regular non-COVID basis, the patients would stay for an overnight observation.
Correct. Why not? Because it's covered by insurance plan.
Right.
Right. And after all that anesthesia, it's great to just go from recovery, get wheeled over to your room. Now, the great thing about Evangelical Community Hospital, all the rooms are private. They just built a whole new, beautiful new section that has replaced all the other rooms for patients, that is, and they're completely private and they're big. They're nice. They're beautiful. So the overnight stay occurs there. And then usually I will come and see the patient the next morning prior to the office. And then we'll just make sure that they're doing great, talk to their nurse, go over instructions for their discharge. And it's not like they have to leave first thing in the morning. I usually tell my patients, go ahead and walk around a little bit, eat, make sure you're comfortable, maybe even eat through lunch, and then you can go home. Or go to usually if they're out of town, they would go to the hotel.
Right.
If they're obviously within locally, they would go home.
But with the times now with COVID up and down and limitations at the hospital, what's going on with that?
Basically, they don't want my patients staying overnight right now because there's no staffing.
Yeah.
The staff, the hospital staff has really been beat up with COVID more than any other area.
Or just beds not available.
In the world, basically. It's the staffing at the hospital. So basically, we can still offer a partially insurance covered procedure done at the hospital, like a corset. Patient will recover in a recovery room and then go either home or to the hotel, which means that if there was a patient that needed to stay in the hospital, we may need to reschedule their surgery if that was the case.
If we really needed them to.
Right now it's a week by week evaluation.
Right.
So they're really trying to limit that from happening.
Right. So that being said, if they do have to go home that evening, not a big deal because that's what we do at our ambulatory surgery center. Discharge them same day, in and out. Right?
Correct. Absolutely. In my opinion, when you recover in the hospital, in the recovery room, we have a setup because the way we do our anesthesia and whatnot, patients can recover maybe in a couple hours and then they're ready to go. In the hospital, it might take a little bit longer because they're hospital-based type of surgery, but they don't get thrown out. They wait till they're meet all the criteria. Yeah. It could be like 4 hours. It could be 5 hours. Then they let them go home. So they only get discharged when they're ready. That's important. Right. They don't get just thrown out when they're not ready. That doesn't happen.
Right. Talk more about our ambulatory surgery center, Lewisburg Plastic.
Yes. So most of my surgeries are done really in our own ambulatory surgery center. It is a fully accredited surgery center, meaning a quadruple A certification. And that is the American Association for Accreditation of Ambulatory Surgery Facilities. So it's an annual certification. Why do we go through this trouble of getting that certified? Well, number one, it's all about patient safety. Number two, if you're an aesthetic surgeon and you're part of the aesthetic society, they actually require it because they don't want you just operating in your office.
Right.
Increased risk of complications. If you want to truly be an aesthetic surgeon, I'm going to talk about aesthetics because that's part of the society requirements. Is you have to operate in a certified facility. It could be hospitals or you could be your own. So we do have this certification, but we also have Medicare certification and a PA Department of Health certification. And the reason we do that is because we take care of Medicare patients. So that's on top of the quadruple A certification.
Right.
And again, that's an annual certificate. So annually we get people that come to evaluate our facility to make sure that we meet all the safety requirements, all the different protocols, staffing requirements, everything you can think of, just like any hospital in Pennsylvania.
Right.
So it is the same certification of safety.
Yes, and that's the main concern of patients not going to a hospital. They want to make sure that things are being done properly and they're
correct. And I think it's important when they do their research, where is the surgery taking place?
Mm-hmm.
And at the end of the day, we do it in a way that it's as safe as possible, and we get approved for that as well. And I think that speaks volumes. I wouldn't do it any other way anyway.
Right.
But it is a accredited facility.
Very nice. So the way our office is set up, if patient, well, it's not like we give tours, but we could probably do that sometime, do a video tour and post that of the ambulatory surgery center, what it looks like and everything. But basically our office, if you're looking at it from the front door, the left half is the actual office, business office, exam rooms, skincare where we do the consultations, see the follow-ups. But the side of the building on the right is where the patients would come in, check in for surgery, go into the pre-op area, then go back to one of our 2 ORs, and then come out to the recovery area. So it's pretty spacious. It's pretty big area.
And that's part of the requirements. The requirements are actually specific size, the flow. All of these requirements have been found to be best for patient care and patient safety. So half of our facility is pretty much the surgical center. That's how much of a space you needed
huge
to have 2 full ORs.
And privacy too. There's a lot of privacy measures taken into account as well.
Correct.
Because we do have 2 physicians here doing surgery on some days. So we try to make things as private as possible.
Correct. And then the convenience of being connected to the office and, the
Absolutely.
clinic. Yeah. It makes it real easy for patients and for the staff.
Right.
And a big thing for us, obviously, you just said it's actually private, right? You're not going to the hospital.
Right.
So basically it's just our patients.
Right.
So if you're talking about COVID times, there's no COVID here. We're not a hospital. So
you're not crossing paths with numerous people. And actually, when you're discharged, it's out the side door. Not like we're kicking you out the back door, but it's a nice private exit where you literally just get transported into your vehicle and you can head home.
And I tell a lot of my patients, since my weight loss patients in particular, their surgeries are pretty much all day, for
the most part.
For the most part. And I tell them, basically, the staff is all yours for the whole day.
Yeah.
I don't have another patient.
Right.
So sometimes they're the only ones here.
Right.
How private is that?
Yeah.
You got a whole surgical center for yourself.
Yeah, attending just to you.
That is a great deal, in my opinion.
Yep. Very true. Okay. Any more to say about the surgery center or the hospital?
No, I think that kind of sums it up. I'm glad we have more than one option, and each of those options I'm very happy with
Absolutely.
for my patients.
Yep. All right. Well, thank you very much.
All right. Thank you, Brittany.
That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the Corset Body Lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.